a clinician who wants to take care, truly wants to take care of people, all kinds of people, this is where to be.
I wanted to provide care to everyone in my community, especially those who are underserved. I believe that everyone should have access to affordable, quality health care.
We see a variety of patients, some patients that have commercial insurance and some that are on state plans, and then some patients that just have no insurance at all. And so we do our best to help everyone in the community. We turn no patients away for inability to pay. We offer a sliding scale or like a discount plan to patients. So the less money you make and the more people in your household, the bigger the discount you receive.
We actually see the patient as the whole patient who needs services. So we rather spend the time getting to know the patient, getting to know the patient's family, so we can figure out what services they need.
I wanted to work in an integrated model of care, meaning that medical, dental, and behavioral health services are located within the same space.
Because we take care of patients who have barriers, being able to provide comprehensive care is essential for those patients. So instead of having to be referred to the OBGYN or to the psychiatrist off-site, we have the ability to collaborate and communicate with those specialists within our own organization, and thus provide patients with, I think, better care than if they had to go off-site for everything.
They have the ability to just practice medicine and not have to worry about the business aspect of it.
Of course, when everyone graduates, they have that big mountain of what am I going to do with my student loan debt? Working at a community health center has allowed me the ability to not only receive a salary that's favorable to other providers in the area, I also get the ability to receive loan repayment. I definitely want people to pursue community health because the compensation and the benefits are great, but then you also get that perk of having this tax-free money help take down that burden of debt. And all you're doing to receive it is just providing care to patients.
In addition, they don't have to cover their own malpractice insurance. We have coverage through the FTCA, through the federal government, so all their work with us is covered.
One of the great things about working at a community health center is most community health centers have very set hours. Most community health centers do have weekend hours, but we don't work holidays and we don't work nights. And we really value that time off so people can be with their families during those very important times.
The nice thing about working in a health center is that they're going to take into consideration your needs as well as your patient's needs, so there's lots of flexibility. A lot of my work I can juggle around and schedule to best meet the needs of my patients and me, and so that's why I've been able to be so active here at the office as well as in my community.
It's so beautiful, always, no matter what season it is or what the weather looks like outside, you appreciate being here.
This area is very beautiful. I mean, it has a lot of natural elements. You can go hiking, you can go fishing. When I drive to the office, I see the mountains. And so it really provides you a peaceful, existence.
We have a lot of great cultural festivals here.
There's everything around and everything is close by. I mean, if you're willing to drive 2 hours to get to the mountains to snowboard, 2 hours to DC, 2 hours to the beach, you pretty much have everything all in one area.
People that have come here have said it's a different breed of people here. People are very friendly, they're very caring. You can walk down the street and someone will say good morning to you and don't know you.
I think the most powerful, the most valuable healthcare is neighbors taking care of neighbors. I've had the opportunity to experience that, and it makes all the difference. People know you. I mean, they know all about you and they trust you. And you can't be anonymous. You're not just an anonymous person providing care to an anonymous patient. What you do lasts, and what you do affects their lives.